A few months ago, I attended to a 51-year-old man here in the United Kingdom.
He wasn't ill.
At least, that was what he thought. He came to the clinic for a simple reason: tiredness. He told me something I have never forgotten. "Doctor, I sleep well. I eat normally. I don't understand why I am so tired all the time." But then he revealed something that completely changed the diagnosis. He started waking up every night, exactly at 3 in the morning. He thought it was anxiety, but when we measured his blood pressure, we discovered something dangerous. It wasn't just a little high. It was silently destructive. The most frightening thing wasn't the number. It was what had been happening inside his body for years without him realizing. His arteries were losing elasticity. Your heart was working harder, every day, without rest. And here's the point that almost nobody understands. High blood pressure does not start with symptoms. It begins with small, silent changes in your body, until the day when the body can no longer compensate. And at this moment, the damage has already begun. Today, I am going to show you exactly what high blood pressure is doing inside your body right now. And the most important thing, how you can start to reduce it naturally before it becomes something irreversible. To understand what happened to that patient, you need to understand what blood pressure really is. It is the force with which blood pushes against your arteries. Imagine a new garden hose. It is flexible, elastic, it expands when water flows through strongly and contracts when the pressure decreases. This is what we call arterial compliance. It is a sign of a young body. Now imagine this same hose left in the sun for 10 years. It becomes rigid, it cracks. If you try to bend it, it breaks. That's exactly what modern life does to your blood vessels. Blood sugar, chronic inflammation, and constant stress act like that scorching sun. They transform their elastic arteries into rigid crystal tubes. And when the blood tries to pass through a tube that does not expand, the pressure rises. And this constant pressure starts to create micro cracks in the internal walls. That's where cholesterol comes in, not as the villain, but as a bandage that the body tries to apply to these wounds. The problem is that these dressings accumulate until the blood flow becomes too narrow. There is an invisible cycle happening in many people after the age of 40. Chronic stress increases cortisol. Cortisol causes sodium and water retention. This increases blood volume, which generates more pressure. More pressure causes vascular damage, which leads to more stiffness. It is a self-reinforcing loop system. That's why that patient would wake up at 3 in the morning. It wasn't psychological. It was the peak of cortisol trying to overcome the stiffness of his arteries. During the early hours of the morning, your body should be in deep repair mode. But in people with silent hypertension, cortisol rises too early. The heart rate increases and blood pressure does not drop as it should during sleep. This non-rest at night is what most damages the heart in the long term. If you wake up at this time, your body is screaming that the pressure system is out of control. Your arteries have an inner layer called the endothelium. It produces nitric oxide, which relaxes the vessels and reduces inflammation. With aging and the modern diet, the endothelium is damaged and nitric oxide production declines. Your body literally loses the natural depressurization system of the blood. That's why the same lifestyle that was neutral at 30 becomes a high blood pressure accelerator at 40. In the United Kingdom, ultra-processed foods high in hidden sodium and refined oils exacerbate this daily. Sodium retains fluid, increasing blood volume. High glucose generates endothelial inflammation, and refined oils cause vascular dysfunction. But now, let's get to the part you really need, the practical and in-depth solutions to reverse this situation. The first major solution is mineral. Magnesium acts as a natural blocker of calcium channels. When calcium enters the muscle cells of your arteries, they contract. Magnesium is what makes them relax. Without enough magnesium, your arteries remain trapped in a state of permanent contraction. That's why so many people experience cramps, palpitations, and high blood pressure at the same time. But it's not just any magnesium. Citrate or glycinate are the ones your body really absorbs. And what about potassium? It is the antagonist of sodium. It helps the kidneys eliminate excess fluid. If you do not consume enough potassium through leafy greens, avocado, and seeds, sodium wins the battle and your blood pressure rises. Try adding a dark leafy salad to every meal for 7 days and you will see the difference in your pulse. Many patients ask me how to lower blood pressure during a moment of acute stress. The answer lies in your autonomic nervous system. There is a nerve called the vagus nerve, which is the brake of your heart. You can activate it through breathing. The 4-7-8 technique is powerful. Inhale for 4 seconds, hold for 7, and exhale slowly for 8 seconds. By doing this for just 2 minutes, you signal to your brain that the danger has passed. The heart slows down, the blood vessels relax, and the pressure drops almost instantly. It is a free and immediate tool that you should use whenever you feel that pressure in the back of your neck or your heart racing. Additionally, exposure to natural light in the morning helps to regulate your circadian rhythm, ensuring that cortisol does not spike at the wrong time during the night. The third solution is environmental. Screen fasting after 8 p.m. is non-negotiable. Blue light destroys your melatonin and ensures that your cortisol spikes at 3 a.m. Use warm yellow lights at home. And what about vitamin K2? It is the traffic cop of calcium. It ensures that calcium goes to the bones and does not get deposited in your arteries, causing stiffness. In the United Kingdom, the lack of vitamin D and K2 in winter is one of the main causes of blood pressure spikes. Supplementing with medical guidance may be what is needed for your arteries to regain elasticity. Remember, the damage is not completely irreversible. Your endothelium can regenerate. In weeks, your body can restore some vascular function if the negative stimuli are removed. High blood pressure doesn't start in the heart. It begins with the silent choices of everyday life. That 51-year-old patient I mentioned at the beginning, he followed this protocol. He adjusted his minerals, started walking 20 minutes after dinner, and cut out screens in the evening. In 3 months, his blood pressure dropped from 160 to 125. The fatigue disappeared. He stopped waking up at 3 in the morning. He got his life back. And you can too. Every decision you make either helps your arteries relax or forces them to work under constant tension. If you have recognized any of these signs, do not ignore it. Share this video with someone over 40 years old that you care about. In the next video, I will show you the critical mistake that even healthy people make, which prevents blood pressure from lowering. I'm Dr. Andrew Collins. Take care of your heart, and it will take care of you.